But what are the conditions for which maybe you should seriously think about coming in to see the doctor or going to an urgent care or an emergency room? I'd like to list a few. Number one, if they're less than 2 to 3 months old and they've got a fever, let's get your child seen. Number two, this would be a child who's just really out of it. I mean, you get the fever down, and even with the fever down, they're listless. They're just, you don't get that sharp eye contact. You know something's not right here. The third thing, we're worried about meningitis. It's very rare, but if you have a child over 2 years of age and they cannot put their chin to their chest. Now, it doesn't work to force their head down because our natural tendency is to resist, but you just say, hey, look here, and the child should be able to really bend their head forward. If they cannot do that and they're looking like this and sort of tilting down instead of this, they need to be seen right away. So a fourth thing would be that child who is just inconsolable. I mean, there's really something wrong, and they also have a fever. All right, you get their fever down, there's still just something wrong. They need to be seen. There's another rash that I want you to be aware of. It's rare, but meningococcal rash, or there are a couple other, but it's usually meningococcal, a bacterial rash that causes, and if you'll focus in on this little freckle right here. So when you focus in on this freckle right here, and I push really hard, you'll notice it doesn't go away, it's still there. You look at this pink color of my skin, if that was a rash and I push really hard, it blanches white and then it pinks back up. So if your child has a rash that's pink or purple and does not blanch, either little spots or little blotches that are flat and do not blanch, then you need to get to the urgent care, your doctor's office, or the emergency room right away. One other thing would be a child who just can't swallow. I mean, they're in so much pain that they won't swallow or can't swallow, and they're sitting there kind of leaning forward and, spit's just drooling out of their mouth. You know something is serious going on back of the throat. That's not a child you're going to wait till tomorrow. You're going to take that child to the emergency room. So in summary, if your child has any of these really serious looking illnesses, by all means, get your child evaluated. But that child who you get the fever down, they look pretty good, they're over 2 to 3 months of age, you don't need to worry. You can watch them, treat them. 2-3 days of observation is not a problem in a basically well-looking child who just happens to have a fever. Even if it's high, up to 104, 105, which is like 39, 40. That's okay. I hope that's helpful. Thank you for watching. I'm Dr. Paul. Please join us on Facebook, Twitter, and YouTube. And until next time, wishing you health and happiness.